Hello and welcome to our creative reflection for the Nursing Leadership course. Upon reflection and brainstorming, we all decided that the area for growth that we all need to improve in our group is for advocacy. There's a great quote by Eleanor Roosevelt who said, "What is to give light must endure the burning." For our table of contents, we're going to start with a poor advocacy scenario, followed by each of our reflections and professional development plans. We will continue to show you a good advocacy scenario and discuss theory of advocacy and how we can incorporate our portfolios. We will also conclude with a nurse and doctor conversation showing a good example of good advocacy. To start, let's show you a poor advocacy video. Good afternoon, Mrs. Singh. My name is Dr. Martin and I'm your doctor today. And I'm also here to talk to you a bit about your decision about your kidney donation. I'm here to report that you are a good candidate because you're a match with your mother-in-law. Unfortunately, I do have some bad news that both your kidneys aren't functioning at optimum capacity. And I think it would be better if you kept both your kidneys. One of your kidneys is working at 100% and the other is working at 70%. And it's my recommendation that since you're still young and you have a stressful job, that you should keep both your kidneys in case you need one in the future. I have to go right now to a very important meeting, but you can speak to your nurse if you have any further questions. I will talk to you later. Okay, bye.
You should really follow what doctor is saying. Why do you want to ruin your life because of your mother-in-law? You have your whole future ahead of you. I'm sure they can find another match for your mother-in-law. I can't take the risk of losing you at such a young age.
Hi, Mrs. Singh. My name is Shivani and I'm your nurse for today. I just saw your doctor walk into a meeting. Do you have any concerns or questions regarding your kidney donation for me?
Right now, my priority is to save my mother-in-law's life because I can live without one kidney, but she might lose her life if I don't donate.
I think you should respect your doctor's decision because he knows what's good for you and your family, and you should follow his recommendations. I really need to go now. Is there anything else you need? Anything? There's a call bell, and I have to go, okay?
In my clinical practice, I struggle most when having to advocate for a patient to their physician. Upon reflection, my personality type is introverted, and my preferred learning style is by reflecting. When I assessed my leadership style, the results of a questionnaire indicated that I tended to be more of a task-motivated leader as opposed to a relationship-motivated leader. In addition, I can identify that my weakness in communicating with other interprofessional colleagues is because of my fear of being misunderstood and fear of interprofessional conflict. Knowing that being introverted, having a reflective learning style, and being more of a task-oriented leader, I can focus my area for improvement and growth by finding tools that help me overcome these potential barriers for optimal advocacy. The CNO indicates that a nurse demonstrates the standard of leadership by ensuring essential advocacy for their patients, place of employment, and the nursing profession. In addition, researchers explain that adopting the position of being a patient advocate is a way to increase the power and the professional status of nursing without damaging long-established images of the caring nursing profession. Identifying and reflecting on my area requiring the most growth enables me to research various methods to improve advocacy and become a more effective leader. Nurses often agree with the perception of the public that the doctor is the only authority and person who makes the decisions, or they may see themselves as powerless and without authority. Advocacy promotes the patient's right to autonomy, and it is essential in providing care with dignity and respect. In future, I can use strategies to overcome barriers to effective advocacy, including being self-aware of personal constraints to advocacy such as my leadership style, learning style, and personality type. In this course, I have learned strategies to overcome barriers to provide optimal advocacy for my patients and in turn become a better leader. I can practice being more extroverted, be more of an activist, and be more of a relationship-oriented leader to assist overcoming barriers to improve my advocacy skills. From personal experience, I understand that the more I practice something, the easier it becomes to do and the better I get at it. Researchers in a recent study state that to become better advocates, nurses need to first identify personal obstacles that hinder them from speaking up and then, using this information to develop and implement a personal action plan of new behaviors to use in patient care situations when speaking up is necessary. A strategy to help me improve advocating includes practicing advocacy with my peers and with my clinical instructor before contacting the physician. I can collaborate more with physicians when I see them on the unit and during rounds. Using practice with collaboration can help me develop more comfort and courage to speak with physicians, which promotes improved advocacy. I reduce the vulnerability of my patients by using these strategies to be a better advocate for my patients and a more effective leader. In order to advocate effectively, I can practice my communication skills and ask for constructive feedback from my colleagues. Understanding my fear of speaking to persons in higher power positions will help me focus on communication skills and lead me to improve my advocacy by being more assertive. I realize that in order to become a better advocate, I must develop professional strategies to enhance my advocacy skill to overcome personal obstacles that hinder optimal advocacy.
In my professional practice as a nurse, there are many challenges experienced when approaching a physician. After taking this course, I can describe my weaknesses and rationale behind this behavior. Reflecting on my learning from this class, I believe that factors like cross-cultural communication and my personality type are main reasons for feeling uncomfortable in these situations. My personality style is extroverted thinking with introverted intuition according to the personality test that I performed in Module 1 in this course. I do believe most in what I experience through my senses than focusing attention to impressions or the meaning and patterns of the information I get. I am a hands-on person, practical and learn best from visual demonstrations and experience. Person's personality affects directly to the conflict handling in different situations. As per Whitworth, I like to provide care by keeping in mind other people's values and beliefs and plan best possible care for them rather than putting my biases and values first. This also sometimes causes conflict due to differences in opinions with physicians due to patients' autonomy. But on the other hand, I struggle to approach to physicians due to power differences. Power differential is significant barrier in effective communication as said by Srivastava. Due to lack of communication and part of high power distance, society where people with high designation or title are believed to have more power than individuals with lower professional title than them. After finishing this course and identifying my weaknesses, my confidence level is increased and I feel more comfortable while communicating with physicians and consider them as a member of healthcare team without considering their power. As nurses, we spend more time with patients than other healthcare professionals and we are with them during times of crisis and distress. So it is up to us to make essential decisions. It is not easy to advocate, however, it is critical in providing safe and competent nursing care.
As a new graduate, I have faced many challenges in advocating my client during my clinical practice. It is important for nurses to advocate in order to provide a safe and competent nursing care. This course helps me to better analyze my weakness and obligations in terms of advocacy. I have observed that my personality style has introvert characteristics and I'm more of an active learner. I'm good at remembering and understanding information by deliberating and applying the knowledge. According to the leadership style test, I am a transformational leader. Being a transformational leader, I believe in teamwork and I equally take all team members towards the goals and encourage their contribution. In terms of advocacy, I believe that powerlessness and limited communication are the barriers to approach to physician. Powerlessness is the key barrier to advocacy, where physicians are considered to have more power than nurses. Also, due to English as a second language, I always feel the hesitancy while advocating with a physician. Throughout this course, I have noticed the improvement in me. I have become more confident and have acknowledged that if I have relevant reason and enough knowledge, I shouldn't hesitate with physician. According to Alice and Hartley, the nurse should primarily emphasize on the client while assessing the need of advocacy. As nurses, it is up to us to make essential decisions as we are the healthcare professionals who spend most time with patients.
Advocating for patients has been the difficult part for me this clinical. My personality type is introvert and my learning style is active experimentation. That is, I learn by actively participating and doing hands-on work in order to understand and learn it better. My leadership style is participative and I value the input of team members and peers, but the responsibility of making the final decision is mine. Participative leadership lifts employee morale because employees make contributions to the decision-making process. Nursing advocacy is a very important part of the nursing practice and is a relatively modern idea. Nurses have reported frustration and anger when they have to advocate for their patient. Advocating for patients is subject to contraindications and can cause interpersonal conflicts. By acting as advocates, nurses are able to empower weak and vulnerable patients, releasing them from discomfort and unnecessary treatment. Patients also require protection from acts of incompetence by healthcare professionals. My personal weakness upon reflection was to advocate for the client, to the physician and the people with higher authority. Vulnerable patients like those with cognitive impairment or those under sedation require an advocate. I realized that I feel timid when it comes to communicating with the doctors on behalf of my client. I feel that I don't have confidence to say even the right thing to the doctor because of the fear of their position power. Advocacy in nursing is like participating with the patient in determining the meaning of health, illness, suffering and dying, providing information and supporting patients in their decisions and pleading the cause of a patient. Therefore, I believe that in order to protect my patient from wrong and unnecessary worry and support them when they're not able to speak for themselves, I should stand up for them. My role as a nurse is to support the patient in their choice. The nurse-patient relationship is very important and I believe nurses are in the best position to advocate for the client because they occupy the middle ground between the patient and the doctors. I believe the most important skill in order to advocate for your client is communication. Therefore, in order to be a good advocate, I reflected that I need to improve my communication skills. I need to communicate with the doctors more effectively so that I become more extrovert and include sensitivity as well as respect while advocating for my client.
In my practice, I've been hesitant to advocate for my clients when it involves addressing someone in another profession or addressing issues upward. I believe this tenderness stems from a lack of confidence in my own nursing assessment and communication skills. I can think of situations in the past where I've had the support of the nursing team to make a change to the client's care plan, but still I felt unsure when addressing the change with an allied health professional. At the time, I believed that I lacked an understanding of their role, or that I may be challenging their decisions without having the requisite knowledge and understanding. In addition, I don't know if I had the specialized terminology to effectively communicate my concerns for the client. Whether the issues that I believe I must know it all before addressing them, or the issues that I lack confidence in what I do know, I expect that exercising my skills and strengths will best allow me to grow into a better advocate for my clients. This puts me in the preparation stage of change, according to Prochaska and de Clement's change theory. I am creating a plan that I expect to enact in the near future. My attributes include extroversion and intuition from the Briggs-Meyer type indicator, being a task-oriented leader through Feidler's least preferred coworker scale, and I have a moderate level of communication apprehension as confirmed by the personal report of communication apprehension assessment. These are the strengths and weaknesses that I will address to improve my confidence in advocating for clients. It is interesting how the personal test both confirmed what I know about myself and illuminated more subtle aspects of those qualities. By gaining better insight into my leadership style, personality type, and communication style during this course, I will be able to identify how my strengths can be used in professional situations and what weaknesses I can improve. Through that understanding, I will be better equipped and more confident to advocate for my clients' needs.
Good afternoon, Mrs. Singh. My name is Dr. Martin, and I'm here to talk to you a bit about your decision about your kidney donation. I'm here to report to you that you are a good candidate because you're a match with your mother-in-law. Unfortunately, I do have some bad news. Both your kidneys aren't functioning at an optimum capacity, and I think it would be better if you keep both of your kidneys. To explain that a little further, one of your kidneys is working at 100% and the other is only working at 70%. So it's my recommendation that since you're still young and you have a stressful job, that you keep both your kidneys in case you need a kidney in the future. I have to go to a very important meeting right now, so if you have any questions, your nurse is around somewhere, but I will see you later. I'll talk to you. Okay, bye.
You should really follow what doctor is saying. Why do you want to ruin your life? Because of your mother-in-law? You have your whole life ahead. I'm sure they can find another match for your mother-in-law. I can't take the risk of losing you at such a young age. No.
Hi, Mrs. Singh. My name is Shivani, and I'm your nurse. I just saw your doctor walked into a meeting. Do you have any questions regarding your kidney donation for me?
Yes, I heard that I can live without one kidney. So right now my mother-in-law is in need of kidney donation, so I don't mind giving away one kidney to her to save her life. But doctor's recommendations are I shouldn't donate at this time.
That's right. As long as both your kidneys are working properly, you can definitely donate. It's up to you. But as the doctor mentioned to you and as your reports show, your one kidney is working at 100% and the other is 70%. But again, at the end, it's your own decision.
I think we should listen to the doctor. I don't want to lose my sister because she wants to help someone else. In future, if you want a new kidney, then what? And you have a stressful job.
But right now my priority is to save my mother-in-law's life. She's in need of kidney, so I don't mind giving away one kidney to her. So let's just think about my other kidney later on when the time comes. If I don't donate my kidney to her, she might lose her life.
Mrs. Singh, I totally respect your decision and I understand your concern regarding your mother-in-law's health. But again, I will talk to the doctor about it so that he can come talk to you and explain you the consequences and other options.
Okay.
But in the meantime, do you have any other concerns at the moment?
I'm just feeling sad that I wanted to help my mother-in-law, but on the other hand, I'm hurting my sister and my family's decisions.
I understand.
You're not hurting me. I just want to make sure you're not endangering your own health and life.
Hi, Dr. Martin.
Hello.
Do you have a minute? I wanted to talk to you regarding Mrs. Singh's kidney donation.
I guess so.
Actually, I just went into her room and spoke to her about her donation. She still wants to donate her kidney, even though she knows that one of the kidneys is working at 100% and the other one's 70. She knows all the pros and cons, but she still wants to donate it.
Okay, well, it was my recommendation. I already talked to her, and I said that she should keep both of her kidneys because she's young, and she's got a stressful job, and I think we should find someone else to donate a kidney to her mother-in-law.
But doctor, it's her own decision. She has the right to autonomy, and I think we should respect her decision. She knows what's right and what's wrong for her. It's just that she's nervous, and that's not helping her make a wise decision. Is that okay if you come with me to her room and just speak to her about it?
Well, I don't know. I have so many meetings to go to. I've got so much other things that are more important to do right now.
The doctor, I think we should respect her decision, and if you come with me to her room, it'll just relieve her anxiety. Is it okay if you come with me?
I guess you're right. If she's scared, I guess I can take a minute and go with you. Let's go get this done.